Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about diabetes and its effect on your heart.
Diabetes has a tremendous effect on the heart. Now, there are two kinds of diabetes. There's something called juvenile diabetes, which you can get in just a very early age. And it is a very difficult problem to treat. And then there's something called adult onset diabetes, and that occurs later in life. So diabetes in and of itself can occur in two different ways. And secondly, it has a very bad effect on the heart generally. So what can you do? Well, here's one thing. It's so important. It gives you a 4 times greater risk of having heart disease and a heart attack than if you didn't have diabetes. So diabetes can affect many organs. It can affect the heart, the kidneys. It can affect the vessels in any part of your body. And it can affect your weight, your blood pressure, your ability to digest foods, to eat a certain kind of diet. I mean, if you throw diet to the wind and say, I'll just eat anything I want, then the diabetes will almost always get worse.
Thank you. And if I knew somebody with diabetes, what are some of the questions that I should tell them to ask their doctor?
Well, many questions. One, is there a family history of diabetes? Do I have that in my family? Secondly, I get up at night and go to the urine more frequently, to pass my urine more frequently than I should. Is that a sign of diabetes? What is the effect of the diabetes that I have, whether it's mild or severe, on my heart and the rest of my body? It's very important to know that. What if I lost weight? Would that make the diabetes get better? Are there medicines that I can take not only to treat the diabetes, but maybe in a very early phase to prevent diabetes from forming? Should I get a nutritionist involved and go weekly and see someone and see if they can get my diet, fixed up so maybe I could lose weight and maybe that would slow down the diabetes? Are there vitamins and minerals, just things you can get over the counter to help treat diabetes or maybe to prevent it? And do I need to follow my A1C? The A1C is important because it tells us how the diabetes is progressing over a period of time. The blood sugar is incredibly important because that tells you at the very moment what your blood sugar is. So those kinds of tests, those two tests are very, very important. And then there are drugs that can treat diabetes effectively beyond insulin and some of the simple drugs. So you might start with drugs that you can take orally. That would be one question. Can I take drugs orally, and do I have to start insulin right away? And then lastly, how can I get help from other people? How can people who have diabetes in a group like this help me understand the disease and maybe help me prevent it or get over it and manage it better?
Thank you. And thank you for watching. Be sure to like and subscribe and visit hearthealthcommunity.com to learn more about diabetes and its effect on your heart.